So I'm going to talk to you today about neuro-ophthalmology. This is again a very important topic and quite complex in its own way. So I'm going to try and make it simple. I'm going to cover only a few common conditions relevant to your practice, also relevant to the examination, as some of these topics will be definitely asked of you in both the theory, and you could get this in the practical. So I'm going to talk today about benign essential tremors. This video should be actually seen in conjunction with the video on Parkinson's disease, as there can be an overlap between these conditions. It's a common condition that presents to the clinicians, and one needs to be aware of it to diagnose this. It's also called essential tremors, benign essential tremors, familial tremors, or idiopathic tremors, and is a medical condition in which there is involuntary rhythmic contractions and relaxation of certain muscle groups in various body parts, mainly the hands, and the cause of this is unknown. In mild cases, it manifests as an inability to stop the tongue or the hands from shaking, but you can also get tremors of the neck. The patients, as the tremors advance and become more symptomatic, they find it difficult to do fine tasks like threading a needle, or their handwriting becomes extremely shaky, and also reaching for objects or bringing a cup of tea to their lips becomes extremely difficult. It starts interfering with the activities of daily living, and they find it even difficult to attend to their personal hygiene. It's a rhythmic tremor, usually 4 to 12 hertz, occurs when the affected muscle is exerting, and usually, compared to a Parkinsonian tremor, this is not present at rest. Any sort of physical and mental stress will make it worse. Parkinson's disease and Parkinsonism can occur simultaneously with essential tremors. The degree of tremor, rigidity, functional disability when they occur simultaneously with Parkinson's disease does not differ. Hand tremor predominated as in Parkinson's disease, and usually it starts in the hands, followed by a head tremor, and can spread to the neck, the face, the leg, the tongue, and trunk. The walking difficulties and essential tremor are common. About half the patients have associated dystonia as well, which can manifest with as writer's cramp or dysphonia. Sometimes they can get cervical dystonia with the neck being in painful positions, such as torticollis, and 20% of patients, as mentioned, can have associated Parkinsonism or Parkinson's disease. Some of them may present with essential tremors and go on to develop Parkinson's disease, so it does become important to monitor these patients and see how they're getting along. The underlying cause of essential tremors is not clear, but many cases seem to be familial. There's also an association which is not invariable, where people with essential tremors show an improvement with alcohol as compared to people who have a problem with alcohol and develop tremors otherwise. The diagnosis is established on clinical grounds. There are no specific tests otherwise to diagnose this, and the essential tremors can start at any age. Any voluntary muscle in the body can be affected, but of course the hands are most commonly affected, and occasionally patients with essential tremor can have it at rest as well, especially when the disease is more advanced. It's unusual for it to start in the legs, and one would have to look carefully diagnosis at that stage. Not all individuals with essential tremor require treatment, but many treatment options are available depending on the symptom severity. We do use as the first line beta blockers or primidone. Some patients may end up needing anticholinergics such as trihexyphenidyl. It does have a lot of side effects, especially giving patients a dry mouth, and sometimes can cause urinary retention as well, so it has to be used with caution in the elderly. Next, anticonvulsants such as topiramate, gabapentin, even levetiracetam, and benzodiazepines have been tried. Some patients show an improvement with pregabalin. More advanced therapies such as botulinum toxin and ultrasound have been used to treat these tremors. However, it does remain a difficult symptom to address and treat, and it continues to be a progressive condition, and patients tend to, in most cases, have become quite disabled as they get older. Thank you.